You're listening to episode 57 of Lifestyle Locker Radio with Dr. Steven Lin.
Scrubbing the surface of the teeth is like taking, when you've got a car problem with an engine, you've got an engine, your car doesn't work. Take it to the car wash.
Hi, I'm Dr. Josh Hand, and welcome to the Lifestyle Locker Radio, where we dive into what makes an awesome lifestyle. From relationships to money mindset, nutrition to fitness, emotional health to peak performance, we bring you on an amazing journey to unleashing your human potential. So here's a little bit about our guest today. Dr. Steven Lin is a board-registered dentist, writer, and TEDx speaker with work published in the Sydney Morning Herald and the British Dental Journal. He has also written for MindBodyGreen and About.com. Trained in the University of Sydney with a background in biomedical science, he is a passionate whole health advocate focusing on the link between nutrition and dental health. His mission is to prevent dental diseases instead of treating them. Steven's program helps his patients solve the cause of dental disease. It merges dental nutrition, breathing, airways, functional orthodontics, and sleep health. Today, the oral systemic link is clearer than ever and is helping the next generation of children to avoid braces naturally. Dr. Lin's nutritional course is PACE accredited and the Academy of General Dentistry Council for Continuing Education. He has trained healthcare professionals in Australia and the UK. He also teaches general health practitioners about mouth-body connection. In January 2018, his book, The Dental Diet, will be released in the US, UK, Australia, and Germany. The Dental Diet is a journey of ancestral medicine, the human microbiome, and epigenetics. It explains the foods for healthy teeth based wholly on whole, delicious foods. All right, everybody, welcome Dr. Steven Lin to Lifestyle Locker Radio. This is awesome. He's our first dentist, and for everybody listening, you're going to love this guy's accent. I think this is just going to make, we're going to have millions of views just because of his voice. So welcome, Dr. Steven Lin.
Hey, Josh. Thanks so much for having me.
Yeah, well, thank you so much. You're the first dentist that's actually caught my eye and wanting to bring on. Because in lifestyle, what I find is it's a very broad subject. It's very broad and very deep. And the more I learn, the more I need to know or more I want to learn. And dentistry is something, I've been going to a dentist since as long as I can remember, obviously. And I've learned so much and always have questions from my dentist. And you just seem to be so unique and fit right into the puzzle of natural health that I love. So I'll let you tell you a little bit. I want you to tell a little bit about your story and how you went from, a traditionally trained dentist to where you are today.
Yeah, it's pretty interesting, Josh, actually, because, I'm trained as a dentist and, dental training is pretty intense, but, generally when you tell people you're a dentist, they kind of like, their reaction is like, oh, I hate the dentist.
Yep.
And that's, yeah. And, we were just talking before, everyone's got that either that experience in the dental practice where they got that toothache or they have that needle or they have that extraction. And they're like, I don't want to, sit with the dentist at the dinner parties. It's a profession that's more or less, I get told that I'm hated by my patients, when you're introduced a couple of times a day. Anyway, so, yeah. But as I went out into clinical practice, I was excited to kind of, help people reconstruct their smiles. That's what you learn in dental school. And, it's a really intense and, very involved training period to become a dentist. And as you get out there, you have these fantastic skills to reconstruct people's smiles. And when you do that to someone, it's an absolutely amazing gift you can give to someone. For someone that has their dental arch and their smile diseased in some way, it's a huge factor in their self-confidence. And when you can give that back to them, it's such a rewarding thing. And so that dentistry for me was very satisfying in that way, is that I could help people. But as I began practicing, and people kept coming into my practice and saying, "Oh, I hate the dentist," and eventually they would get over. It's all about, you learn how to deal with dental anxiety. It's part of it. These questions kept popping up, and it started to resonate in my mind. I was thinking, why do people hate the dentist so much? Why is this a part of society that we just, dentists are very isolated. we're a very small and kind of like disconnected part of the healthcare system. We're actually disconnected from the healthcare system, literally. In Australia and the US is quite similar, is that you have to pay, you guys do a little bit more insurance over here, but for the most part, you pay out of your pocket in some extent.
Well, I'm a chiropractor, so it's not, I'm in the same boat.
Exactly. And it's quite strange. We've segmented the mouth, our backs. Like, are they important parts of the body? Yeah. But this is what we've done with our healthcare system. And so dentists kind of exist in this bubble where people come in scared and afraid. And so I began to think about that, and it was really began to play on my mind. I was just seeing a stream of sick people coming in, people with gum disease, broken teeth, tooth decay, kids with their jaws weren't developing. So no kids that I saw were developing jaws that could fit 32 human teeth. And now that began to really kind of play on my mind a bit. And so my training did not address why that happened. There was absolutely no one asked a question. We learned how to classify it. We could identify it, and then we would treat it so we could get a nice straight smile in the end. But there was no searching for the root cause. And so this really began to bother me. And I began to look through dental textbooks and kind of, doing extra education in CE. And, I began to realize that the answers aren't there. No one is looking at this. And then, I really began to become bothered with my work because I was seeing sick people. They were asking me questions about their health and about, how can we stop this and why is this happening? And I didn't know. I could say, look, we've got this lovely, crown that I can give you, yeah. or these braces we can put on your kid, for $5,000. And that's great, but there's a big piece missing. And so I began to feel like I wasn't sure if I'd be able to do this for the rest of my life. So I took some time away from dentistry. I traveled, trying to think about, what I was going to do and whether I could practice for the rest of my life. And I actually stumbled across a book in a traveler's hostel in Istanbul. There was a shelf, and it's where people kind of leave their books and kind of swap things as they go on their way. And it was a book called Nutrition and Physical Degeneration by Weston A. Price. And I'd never heard of it. And so I saw the title on the neck of the book, and it kind of struck my eyes because you don't see a dental title right in holiday. It just doesn't happen. But yeah, so I looked at it and I didn't know what it was, and I looked through this book, and it was like another language to me. But it spoke in a very kind of very, very deep level where I felt that there was something to Price's work. And actually, he showed, there was thousands of photographs. He documented how he went to 14 different civilizations and showed how dental disease doesn't happen when people eat a traditional diet. That was his broad message. But I didn't understand that. And my clinical training taught me that wasn't true. And I thought, no, this isn't right. This guy's missed he's got the screw loose somewhere. And so I actually put it away. I went back, to practice, but it kept playing on my mind. And so I eventually went back to Price's book and read it much more deeply over and over and over, and realized that I didn't understand it. And then as I began to kind of go through all the things he was talking about, I began to find different areas of research now that are plugging into what he was saying. And so all of a sudden I was seeing that, hang on, we've got science now that is talking about what Weston A. Price was talking about, in that crooked teeth and wisdom teeth impactions, jaw development, the whole face, like when the dental arch grows, it is exactly related to how the jaws grow. So crooked teeth are a symptom of our jaws not growing properly. And that's a craniofacial system. And so this is what he was showing. He didn't say it in those words, but this is what he was showing that was happening when people stopped eating these foods. And so all of a sudden, I had this answer for all my questions during practice. And, as soon as you start giving nutritional analysis to kids whose jaws aren't developing and to people who have gum disease and tooth decay, you find that they are deficient in the factors that he was talking about. And so that I realized that there was a huge, huge missing piece here that we'd somehow forgotten, and that we're basically a species with amnesia that's forgotten we've forgotten how to feed ourselves. That so much so that our craniofacial and jaw system has stopped stopped growing. And the orthodontia epidemic that we're now sitting in, over 75% of kids, and nearly, I don't see any kids that develop wisdom teeth that sit up, that don't dig into their gums, which is what happens when the jaws don't grow. We think that's normal. There's over 10 million teeth are extracted every year. That
wow.
is, yeah, it's insane. Well, barely any wisdom teeth grow non-impacted, so that there is certain little impactions, and then whether you get them extracted or not is kind of whether what your dentist says and your access to surgical care. But we're just pulling wisdom teeth out, and no one's asking why. But it's the same problem as why we need braces. It's all jaw development issue that doesn't give us space for the teeth to develop, and it's all nutritional. And so that was my key, and that was my my inspiration for writing The Dental Diet, and integrating nutrition into and helping people. We need to prevent orthodontic braces, and we can do this through food if we understand how to eat for a healthy mouth.
Oh, that's pretty neat. So, in your bio, you mentioned looking at the human microbiome and the microbiome and your website, and was what I've read. It starts in your mouth. It's like that's like step one. We're all focused on always whatever step that may be in our gut and our stomach and these different areas, but there's always, step one. That's pretty neat.
It's a crazy idea, right? That our digestive system is connected to the mouth, right?
But we don't think that, we all think, I got to do a cleanse, I got to do this, I got to do that. Everything is gut related.
Yeah, we've kind of come. I mean, the movement to gut health and intestinal permeability in medicine now. We've got thousands and thousands of papers on how these mechanisms of chronic disease begin in the gut. That it's funny that we're trying to treat the problems at the end of the road when the mouth and the oral microbiome is a related and much more measurable, and also we can intervene much easier in the microbes in our mouth. And dental diseases are known to be bacterial disease. We've known this for decades, even before. And this is the crazy thing about how misaligned we've been on this, is that before the 1980s, we didn't acknowledge that bacteria lived in the digestive system with H. pylori.
In the 1980s?
Yeah, well, it wasn't until the 1980s.
Wow. Holy cow.
So that's when they made the link between H. pylori and stomach ulcers. And it was two Australian scientists. Of course,
right?
Yeah, of course. Yeah. Who else? But they kind of went about it in a very cavalier way. They're like, they said, we think stomach ulcers are caused by H. pylori. And they were absolutely canned by their peers, as all new ideas are. And so they said, no, this is wrong. You're absolute quacks. And what they did, as Australians do, they're like, right, we're going to drink a broth of H. pylori, gave themselves stomach ulcers, and then ultimately did a trial on subsequent people to prove that it was, wow. And they would give a course of antibiotics after to cure it after. And then all of a sudden people are like, oh, geez, H. pylori causes stomach ulcers. It turns out that bacteria can live in the digestive system. So it's only 3 or 4 decades that we've acknowledged that bacteria live in our stomach. But we've known that tooth decay, for instance, is an infection. And that's what we've seen it as, is that, it's strep mutans, and it's a certain type of bugs that grow when we eat sugar. They infect the teeth, and our teeth rot. But now that we see with the microbiome, we've got trillions of bugs living in both the digestive system and the mouth. They are symbiotic. It is a system that you have microbes in the mouth that are protecting you against tooth decay, protecting you against gum disease, bad breath, the whole array of conditions that we see in the mouth. And they're the first signs of gut dysbiosis. And so when we treat problems in the gut, that's the end stage. And so the gut problems are very, very difficult to reverse, like irritable bowel disease, things like autoimmune problems, metabolic conditions. But if we that's because we're not looking to heal the whole system. And the mouth gives us a perfect model for that. It's really an illogical way that we've unfortunately missed one of the easiest and most practical ways to kind of get a hold of our whole body health.
Yeah, you have to actually go upstream to find the beginnings of the problem. And that's
exactly.
So here's a question for you. And I don't know if this has been in your research or not. And I sometimes put people on the spot here, but I'm going to ask anyway. Because when you're seeing children with these dental problems, is it always the nutrition of the child, or does it have anything to do possibly with the way the mother, was eating or during the child's development?
You're exactly where this leads now, because what the oral environment, what that model gives us now is to show that. So if we talk about the oral microbiome, we know when a child is born, that their digestive system is relatively sterile. Not sterile. There's a fecal, placental microbiome we know now, but what we know is that when a child is born, they're introduced to outside bacteria via the vaginal microbiome as in the birth canal. And then what happens? And where is that bacteria introduced? It's introduced into the skin, the mouth, and the oral microbiome is the seeding agent for the digestive microbiome. And so what happens is that in the first months of life, the oral and gut microbiome are very similar. And so what the mouth bacteria are basically feeding to the gut what will be the digestive microbiome, and then eventually the immune system. So we've got a direct connection between how the mouth and the gut are in constant communication, yet we're looking at the gut and thinking about how a kid's immune system is forming. Well, it's all starting in the mouth. And the amazing thing is that we now know that a mother's gut actually has a system and a lymphatic system to transport gut microbes to her breast milk, up to her mammary glands, and then deliver the breast milk microbiome to the child's mouth. So then you've got a transport system from the mother's gut to the child's mouth via breast milk to the child's gut. So you've got a direct line there from immune system to immune system, and how a mother's immune system will then, obviously shape the child's immune system. And we know this stuff. Absolutely, it impacts the lifetime, risk of disease. We know all the things. There's good data now that those early periods, especially the difference between cesarean and vaginal birth. We know that kids have high risk of allergies and other immune system problems. And so this is all an issue with not seeding the right bacteria. But it doesn't stop. It doesn't, all of a sudden when we get our immune system, this is a constant message that we're sending to our mouth and gut. And so that's why it's so important that we take our mouth into consideration and think of that first and connected. It's so simple when we think of it this way.
Okay, and going back to the birth process in kids, this is really interesting, because I've never thought of this until we're having this conversation. So, is there? I know overall health wise, breastfed children are much healthier. So, is there a disconnect also between like the oral and gut microbiome, when kids are bottle fed with like synthetic formulas and they're living on I guess I've seen children that, just they start that way, and then their diet in general just, pardon my French, just sucks.
Yep.
After the fact. So does that affect their teeth? Their whole teeth, their oral microbiome?
It absolutely. We know it affects their risk for things like allergies. The main thing that we know that that affects a kid that is breastfed as compared to bottle fed is that kids that are bottle fed do have a higher risk of crooked teeth, and the reason for that is that there's function in the and the microbiome part is a huge issue if they're not getting. And one other factor actually with this is that kids that are breastfeeding are even getting tooth decay now, which shows that mothers are passing deficient breast milk to their kids. So that's one thing. And there's a whole plethora of problems here. Things like if the kid's not feeding right, if they don't have, if they have an oral restriction like a tongue tie, they can't, the milk pools around their lips and they can get a risk of decay. And so there's a real misconception there. But the big one with breastfeeding is what we know now is that it develops the jaw. So when a child breastfeeds, they have to use their tongue to push the mother's nipple against the palate. And the palate is soft like wax in those early months. And soft like wax. And so what's happening then is the bone's expanding. So it's getting this constant message to expand. That's their maxilla. And so that's developing their nasal airways. And it's developing a flat, wide palate, U-shaped palate through pressure and then tongue function. So tongue function should then always be to the roof of the mouth, and this is we've lost this now. And this is where oral function and functional dental development comes in. Is that we know that breastfeeding actually has a functional component, and then when the tongue is held to the roof of the mouth, all of the muscles that hold, all the muscles that the hyoid bone, the base of the skull, this is your stuff.
Yeah.
All of that is turned on. And then our airways are turned on. The kid learns to breathe through their nose, which we know delivers nitric oxide. When you mouth breathe, you lack nitric oxide, so you're developing delivering oxygen deficient. Well, not oxygen deficient. You can't deliver oxygen efficiently to your cells because it doesn't have those.
Interesting.
Yeah, and
so
that goes through.
Reason nose breathing is good.
Absolutely. Yeah, nose breathing is one of the. So if we get kids to breathe through their nose, have closed lips, and have their tongue to the roof of the palate, this is myofunctional orthodontics, their teeth develop naturally. So we can correct a dental development just through function. But there's also the nutrient factors as well. And so, yeah, the vitamin D, vitamin A, vitamin K2, which was Price's theorem, is that they're the bone growing factors. Without D, we don't absorb calcium. Without K2, we don't activate the proteins that carry calcium into bones and teeth, both bones and teeth. They activate an immune system inside the teeth. So each tooth has a little immune cells called odontoblasts, and it's part of the osteoimmune system that are activated by these 3 vitamins. So if you eat enough of these things, you are immune to tooth decay. And that's why dental disease doesn't occur in any biological system on the earth until we start eating the industrial diet. So that's, if you look through the anthropological records, we don't see dental disease anywhere until we start removing these things and removing all of these factors that develop a healthy mouth.
Yeah. And make us healthy, period.
Exactly. Well, that's the thing, right? Because I can see, all of the implications for the rest of the body, and vitamin D does everything through the body. The digestive system, the immune system, the brain, the skeletal system, and yet I test every patient that I test that has dental disease is vitamin D deficient, and yet we now know that the studies related to problems like tooth decay and gum disease. But it's this long-term chronic disease process that's going to give them autoimmune disease in the future, and type 2 diabetes and obesity and Alzheimer's disease is a strong link to brain degeneration later in life. It's such a simple yet powerful connection that we've just horribly misunderstood.
Yeah. So knowing that the nutrition, the functional aspect of developing and aging will all have this huge impact on like oral health, which can have effect on the gut. I mean, we'll say body health, whole body health. The dentists, that I know that I've spoken to, not that I've seen all of them, but brushing your teeth it's like the most important. Brushing your teeth and flossing are the most important things that are always pushed. And are they actually doing the best for you or not?
Well, I mean, as soon as we start talking about it, you start to realize how limited that advice is. And because, we've only really been brushing and flossing for, barely 50 years. And let me tell you, as a dentist, nearly no one brushes and flosses well to start with. So no one does it well in the first place. But does it actually work? Well, the FDA actually removed flossing from its recommendations because the research shows that that was in 2016, that that the benefits aren't proven by science. But once you start thinking about how complex the oral environment is, just interproximally cleaning your teeth, of course, isn't going to control the thousands and thousands of microbes, the inner immune system of your tooth, all the other issues that are controlling gum disease and tooth decay. Scrubbing the surface of the teeth is like taking, when you've got a car problem with an engine, you've got an engine, your car doesn't work. Take it to the car wash. That's what.
Okay.
That's what brushing and flossing is like. But I don't tell people not to brush and floss. It's got having a nice looking set of teeth and keeping good oral hygiene is all a part of it. But we need to reprogram our perspective to show it's not the be all and end all, because our dental advice has been purely focused on brushing and flossing, and it's so limited, and we've limited ourselves in that way.
Yeah, and it's funny. I'm laughing because I'm thinking about your TED talk. When you had everybody raise their hands. Who's not flossing? You see the guys in the back have their arms crossed, and it's like, okay, if you're not flossing, you're affecting your health, which also is kind of correlated to what, like erectile dysfunction.
Yeah, exactly. Yeah, so the vascular dysfunction in gum disease and bleeding gums links to erectile problems later, and it's probably already related to inflammation. But suddenly people who didn't care about their teeth, like they kind of sit up when they're like, oh, geez, I better start flossing, right? It's like
exactly. But how do we find? I mean, I guess women are probably better at it. I know my wife definitely is a lot better at it than I am. You know, if I walk in and she happens to be brushing her teeth or flossing, I'm like, oh crap, I gotta grab, I grab it from her, type of thing. I'm like, all right. But are there, I want to mention your book, The Dental Diet, which is coming out, what did you say, the 9th?
January 9th, yeah.
January 9th of 2018, which I'm excited about because, you got a foreword by Dr. Mark Hyman. And for those of you who know, he's like almost like the father of functional medicine. Am I right? Or something like that?
Yeah. Well, he's really led, the great thing about what Mark's done, he's really led this push into how we change, how we get all these functional concepts and how we bring it into a medical system. And, what they're doing out there at the Cleveland Clinic is so great. And so it was such an, honor to have Mark write a forward for the book. And, really what I hope is that we can get this conversation between the functional medicine, community and the functional dental community and bring this together to get a truly, truly, holistic whole body approach out there to the masses, because we need to change this drastically. We're dealing with things that just do not fix these problems.
Yeah, I mean, like pre-call or pre-recording, we were talking about people being so brainwashed and brand washed that it's we're taught like a pill for every ill. Just brush your teeth. That's and floss is be all end all. And it's amazing the amount of good content. Like your website alone is like a plethora of really good information.
It's been such a big journey. There's so much science out there to this and once we kind of just flick, I was the same. It took me years. I saw Price's book and I thought, that's not, we're living in 2000. It's 2012 here. But there is so much science out there to show us how to eat for a healthy body. And if you just look at your teeth in a different perspective like that, it is real life changing. In terms of it is much easier instead of trying to treat things like metabolic conditions and weight conditions and all of these things are downstream effects of what we're doing wrong up in the mouth. Yeah,
which is, I mean, it's so unreal. Just look, I was from poking at your website before and looking at the title of your book, The Dental Diet. I'm like, okay. And then I'm looking at the bottom, surprising link between your teeth, real food, right? It says real food, not what we're normally eating, right?
Oh, yeah.
Life-changing natural health. That's like, this book better be like, what, 2,000, 3,000 pages, right? I'm just kidding.
I look at it, yeah. Well, a lot hit the cutting room floor, and actually, my website, I really cover a lot of the topics on my website that I couldn't, because the book writing process is brutal, and the stuff that didn't make it in, it is all on my website. That's all up there. But yeah, you're right. There's a lot of stuff in here. There's nearly 300 references, covering it's such a broad range of science, and bring the mouth gives us kind of the a way to kind of bring it all together and discuss it all on under one umbrella.
Yeah, which is cool. I mean, you opened my mind. I mean, I've heard natural dentists speak or holistic dentists speak, but nobody like you. I mean, you really opened my mind up just from first browsing the website and then this conversation. I'm like, holy cow, this is.
There's good information out there. Yeah, something that, and especially we talked about before, is that there are dentists doing amazing work around the US, and I'm really going to work to get their stuff out there too. Because we can now, there's things we can do to intervene to prevent braces in kids. We should never be waiting for kids to develop their adult dentition, extract teeth, and then drag braces back. That should never happen. We should be getting earlier in the developmental cycle, fixing their food, fixing their breathing, fixing their function, and then we can actually get them to grow properly and all their teeth fit. And the downstream benefits of that are just absolutely, because we're now in a breathing epidemic even. So there's 70 million people in America with sleep problems. And this is all related to our jaws not developing properly because our airways aren't set. So when you go to sleep, you're actually choking yourself. And so that's what sleep apnea is, right? But when you think of sleep apnea, you think of snoring, you think of overweight male, is basically a heart attack waiting to happen, which he is. And that's what we link the literature to between snoring and heart attacks now. But there's many, many more people with sleep problems, and it's all related to the jaws. So people with upper airway resistance syndrome, these are people that grind their teeth. So teeth grinding is where you actually move the jaw forward to open the airway at night. That's the reason.
Interesting.
That's your survival. That's your brain trying to survive. And all that is there are detectors in your airway. So when it detects a certain level of pressure, it will actually cause your brain to open the airway. And so that's what's happening when you're sleeping. But so you're basically choking at night. And so teeth grinding, and so what you present in a symptom sense, you have you don't sleep well, you're tired all the time, your digestive system doesn't work because you're constantly in sympathetic autonomic drive, not because when you sleep you have to be going to parasympathetic.
Yeah. So that's fight or flight, people. That's what we spoke about this before. Fight or flight or rest and digest, right? Just so they know. Sympathetic is the fight or flight. Good, keep going.
Exactly. Sorry. Yeah, thanks for I got two, isn't it? Yeah, fight or flight. So, but when you're sleeping, if you're constantly in fight and flight, then your brain is in survival mode, and so that's why you're exhausted all the time. Cold hands and feet is a good sign that this is happening. But people with small jaws, so the most common patients I see this in is in slender women with small necks and small jaws. They got tiny little mouths. They're a dentist's nightmare. But they don't. Yeah, it's hard, but they don't breathe well at night, and they've got this syndrome that they can't identify, and it's a sleep problem. It's because their jaws didn't develop. And kids are the same. So kids walk in, they have these skinny faces, they have bags under the eyes, they wet the bed at night, they have their mouths are open at rest, their tongue hangs up open, they don't sit their tongue properly, they have a high, very narrow V-shaped palate, and that's a surefire sign they sleep with their mouth open. They may even be snoring. There's a good percentage of kids now that have sleep apnea, and what this is linking to is ADHD. So the amount of kids that the literature is now showing that that behavioral issues and is linking back to not having those good night's sleep. And so if your kid isn't performing at school, be thinking about how they're sleeping and watch them. And so this is stuff we can be doing, every day at home as parents. We can be looking at our kids every day, how they're breathing, how they're eating, how they. The most important dental exam you'll ever give your kid is the one you give yourself. And so it's a very interactive and functional model that we need to bring into, because every day of your child's life is affecting their dental development, and this goes right throughout life as well. We can even expand the palate in adults. So there's adult expansion now, and what happens is that you can expand the palate out, and the entire face changes. I've seen brain surgery software that shows when you expand an adult's palate, their whole face changes. So the maxilla will put bone on, the mandible will actually put bone on, so that the face will widen, but the eyes will level as well. And then also on the scans, this is is it the sphenoid bone? And this is your stuff, right? The sphenoid bone remodels when you simply expand the maxilla, and that's through oral posture, setting the breathing right, and you're sending epigenetic messages to reprogram the craniofacial structure to get where we should be. And so, we can intervene in this stuff. We need to, it's not a hopeless thing, once we've kind of developed and gone down the wrong track.
Yeah, you're mentioning like the jaw development, and it made me think, I'm pretty sure I read something, this has got to be early on in practice for me, so just over 10 years ago, children with braces, because it locks the bones in the skull, actually helps, or doesn't help, causes scoliosis in the spine. I don't remember if that's real research or not, but I remember hearing this way back when. I go, oh, it kind of makes sense. Your head's not respirating.
Well, so we had a little technical error here. Actually, it's a web error. So what we're doing here, I'm going to let you know that you can get more details at lifestylelocker.com/Steven Lin. That's lifestylelocker.com/Steven Lin. And now, back to the show.
I apologize, but gotta love technology.
Yeah, Josh, I was so excited when we talked about doing this podcast, because the conversation between dentists and chiropractic is one of the most exciting that we're going to have moving forward. And this stuff is really new, but the idea that that we have a craniosacral rhythm and that is affected that reverberates right through the skeletal system is just fascinating. It's such a new area. And so what we find is that when we put braces on, braces are just addressing the symptom of improper craniofacial growth. And so when your jaws don't grow properly, you'll learn to adjust in some way. You sit them in a certain way. The teeth fit in as they're allowed to. And then your dental occlusion, which is the upper and lower jaw, sit together. And now, so the dental occlusion is just where your craniofacial system has, adjusted and just come together. But what this does is it's reverberated right through the skeletal system. So people that have had extraction orthodontics, so premolars extracted, which is very, very common over the last decade. You should never have extraction before orthodontics without many, many consults. But what happens is that their jawbones are retracted and they have to sit forward. And you would probably see this in your practice a fair bit, is that people that have had orthodontics previously, they actually poke their head forwards, and kids are the same. So it's their skeletal posture that is actually, so their head doesn't sit straight on top of their on top of their spine, and so that's actually putting all that pressure there. But it's a matter of holding their airways open, because the airways are all here, and then so the jawbones are basically the architecture of the craniofacial airway. If the jaws don't develop properly, the skeletal posture has to develop to make sure that, because oxygen is the number one nutrient. That's something we learned.
We need that, right?
Yeah, I think we need oxygen, right? Yeah. Maybe a little bit. Yeah. But yes, this is one thing I try and drive home in the dental diet, is that oxygen is the number one nutrient, and breathing is the first thing we need to be thinking about, because that's what your body thinks about. But so if your jaws don't develop, then your skeletal posture has adjusted so that you can breathe. And so people that have had braces, and so scoliosis, so curvature of the spine, is an adjustment of what's happening with the dental occlusion. And so that's why they've linked people with certain types of braces or to certain types of scoliosis, for instance, and the connection. And so you can actually correct scoliosis in kids if you grow the dental jaws if you get early enough in the developmental phases. So the connection to the skeletal system is just fast, and this is one that I've really only kind of recently got into. And I'm really excited to kind of talk about this more actually with you. But the teeth are just a symptom. So when we put braces on, we're just veneering a skeletal system that is completely malformed because we haven't fed it the right thing, we haven't functioned the right way, it's just a very, very limited approach.
Yeah, and kind of, you're putting all this in perspective, and me thinking about the children we take care of and the adults that I see as well. That when we have, you say that we have to have that forward head posture when we start to change the structure right in our mouth. When we have a forward head posture and we look at that starts to prematurely age a person as well. And you said, because now we start to have to, we have people know cavities, understand that very simply with teeth when they break down. But we're seeing this, as an aftermath possibly from, dental work, premature breakdown of the spinal structure, which now can affect the central nervous system. So it's this double, triple, quadruple whammy of
absolutely, yeah,
deteriorating health.
Completely. And and even going back to that breathing, people that are kids, especially, that aren't breathing properly, aren't delivering oxygen to the brain, so they're in they're missing all those developmental problems. They are sending epigenetic signals that will affect their telomeres, and they're aging exactly as you say. All of the connections, and it's suddenly in this cycle, and it's just so obvious. Wow. But the connection to the skeletal system, you're right, is just so, so important. I can't believe, we've had dentists and chiropractors are probably a little bit similar in that way. We've kind of just been left out of the picture a bit. But we've got two of the most important parts, the jaw and the spine. They're two of the most important parts, yet we've not connected this to a healthcare system, where we link all these problems that we see other issues. It's just so obvious. Yeah, I'm really excited to really learn more about that too. It's such an exciting area.
Yeah, I'm glad we just kind of went down that rabbit hole for a few minutes. This is really cool because, in my search and reason for having lifestyle lockers to help people maximize their human potential. And that doesn't just mean going to a chiropractor, doesn't just mean eating healthy, that doesn't just mean brushing your teeth. I mean, it's this mindset and all of these things. It's such a huge connection. I start to have conversations with, experts like yourself, which you're going to be, you're going to be like a New York Times bestseller with this book in probably about T-3 seconds once it launches, is my guess, just based on your knowledge alone. But the connection between everything and everything, if we don't start paying attention to the core things that keep us healthy, it's hard to be happy in life. Then it's hard to live a long time. I mean, it's this whole huge, either very good thing or very bad thing.
Yeah, it's really quite tragic, that there are a lot of sick people out there looking for answers, and they're so desperate, and they're just not there. And then, I've had a lot of people write on my website, for instance, that they've, for instance, for sleep problems like I've been going to doctors about digestive issues and sleep and anxiety and depression. They've been on anti-anxiety medications. And then the issue all began because they had extraction orthodontics, and that they need their jaw and their oral posture fixed. And so they went to a dentist that understood this, and then all of a sudden they could sleep, they could breathe, and then from there their body starts to heal. And it's often a long road from there, but there's hope, and just their life is completely changed. It's just so it's really impactful that if you can actually help a person in that way. And it's just been such a great journey seeing how all this comes together.
Yeah. So I want to finish with this. If you can give, I mean, you got a million things you can give as far as information, but just 3 action steps that you think people could take for better, I mean, as a word, oral hygiene, is that the right word for you, or?
Dental health.
Oral health. Good. Perfect.
Yeah,
we'll use that. That's a better. I just want to use the correct wording. It's not my field, so it's like, I got to think about these things.
Yeah, no, exactly. Well, there's 125 medical professions, and none of them look at dental at all. So it's it's not many people's field specialities.
Yeah.
But I mean, 3 factors. The one big thing is to remember that that number 1 nutrient is oxygen. So nasal breathing, and so holding your tongue to the roof of the palate with closed lips, that is the most efficient and effective way that you can deliver oxygen to calm your nervous system, slow breathing, and to actually help your dental development as well. So nighttime nasal breathing. If you have an 8 hours of nasal breathing, making sure your lips are sealed, you're giving your brain and your body all of those nutrients that it so desperately needs. So number 1, nasal breathing. Number 2 is making sure that we're eating the nutrients that create strong bones and teeth. So I would get your vitamin D tested straight away. And so anyone that lives in a cold climate and visiting New York at the moment, you are likely vitamin D deficient. If you have bleeding gums, if you have any kind of gum disease, tooth decay, if you had crooked teeth, you are likely, it is all symptoms of vitamin D deficiency. Get tested, know your levels religiously. There is no, oxygen is number 1, vitamin D is likely number 2, probably maybe after water. And then after that is reintroducing nutrient dense foods with fat soluble vitamins, like things like liver and eggs from pasture raised chickens, butter, fermented foods like natto and kimchi. These foods have A, D, and K2. Make sure you're getting K2. Cheeses as well. It's a very difficult food to get, but it works alongside vitamin D. So if you have vitamin D, you need K2 alongside it. And so make sure you're getting that as well. So foods rich in A, D, and K2 every day. And so test your D levels, breathe right, and you will be setting yourself, as a base level, because remember the dental health is kind of our base. If you have any other issues, you're going to be pushing yourself along, and everything else is going to start fitting itself into place.
Awesome. Well, Dr. Steven Lin, everybody, thank you so much. I absolutely loved having you here. I wish we were hanging out actually in my locker room here talking.
Yeah, that's right.
But thank you so much. It was a pleasure. I'm definitely going to have to find you when I go down under if you're not traveling the world. And I appreciate it.
Well, I'm back here in New York next year, so we'll have to get together and talk bones.
Totally. It'll be a blast. So thank you.
Yeah. Thanks, Josh. It was an absolute pleasure.
Everybody, Dr. Steven Lin, thank you. Yes. Way cool. He's the first dentist we've had. He's an awesome guy. This guy connects the microbiome in your mouth to the microbiome in your gut, to mouth health, to oral health, to spinal alignment. This guy's a dentist. How cool is that? So make sure you go and get his book called The Dental Diet. It's coming out January 2018, which is right around the corner. So keep your eyes peeled. We will definitely be sharing links once it's live. To get more details on Dr. Steven Lin, all of his contact info will be in the show notes, and that's going to be at lifestylelocker.com/Steven Lin. Remember that. And check us out on Instagram at Dr. Josh Hant and on Twitter at Dr. Josh Hant. All right, Locker Nation. Peace out.